This is an acute angle closure patient that I've recently seen. They came to me from another physician with two PIs already in place. And so what I'm showing you right here are the two PIs. I've already taken out the cataract. I'm just putting you into my gonio view right now. So I've already tilted the head and the eye approximately 30 degrees. So the goal here is going to be to actually use my RPT cutting forceps to pull down the iris and open up the angle. So initially there you see no angle structures with a little bit of a downforce right near the angle itself on the iris. You can see the angle is now open. And so I have enough angle to actually, or enough visibility and trabecular meshwork available now that I can give a small goniotomy. That goniotomy allows to thread this catheter through the trabecular meshwork. Now pay attention to the two areas circled in red. As I'm going around, I'm having my assistant click or inject small amounts of viscoelastic. My goal is usually to get somewhere between 30 and 50 clicks per treatment. Those two areas that you're seeing in the blue there are areas where you can see obviously the eye has gone from red to white, and that is just demonstrating that pushing force of that viscoelastic or canaloplasty down through the distal collector channel. So you're seeing the actual blood or injection go away because the viscoelastic has taken its place. So we're 360 degrees around with the catheter. I'm now pulling out, so this is the GAT. So this is what further opens up the angle that was previously closed. I've had very, very good success with this procedure in my angle closure glaucoma patients. Thanks for taking the time to watch this video.